excited to introduce a new segment on Hawaiʻi Daily called Your Health with Queens. We'll be highlighting the Queens Health System's outstanding programs and caregivers, along with the legacy inspired by Queen Emma. And joining us today is Jason Chang, President and CEO of the Queens Health Systems. Thank you so much for being here with me today.
Thank you for having me. I appreciate it.
Absolutely. Now we have to talk about the Queen Medical Center. You folks have this long-standing history here in Hawaii when it comes to legacy, when it comes to community. Let's talk about the impact of Queen Emma and King Kamehameha IV.
Yeah, it's amazing. So if you go back 165 years ago, Queen Emma and King Kamehameha IV, they founded the hospital because they saw the Native Hawaiian population being decimated by disease. And they went door to door. They didn't have wealth. They went door to door and they fundraised $13,000, which became the first Queens Hospital right on our Manamana campus.
That's incredible. And over the years, we've seen a lot of growth with Queens Medical Center specifically. There is now an expansion with the hospital there on Punchbowl, and that's in the emergency department. Can you talk to me about that?
Yeah, it's the most obvious because it just opened and it's the brand new emergency department. So it is, we needed it so badly. So patients are coming in and they've had to, if anyone's been in that emergency department, you know, the waits have been long, but everyone across the state, when you get sick or you get hurt, that's where you end up. And we knew that we had to expand. Population is growing, the needs of the community are growing, so the investment was made to expand it. It's 3 stories. We have state-of-the-art diagnostics, we have privacy for all the patients. Because in the past, if you knew that you would come in and you would be next to the person that was there because of a STEMI and a heart attack, or you could be next to the homeless patient that had behavioral health needs. And it's not the best environment. So the investment was to create some segregation, to give people with behavioral issues some dignity to get care the way they need care. Everybody that's able to make a choice, but their doctors are closed, that they would get the personalized care in a private way. And then the trauma, the patients that really need us the most would have state-of-the-art technology for them too.
So many different services that you folks provide, and I know that there are some things that you folks do that no other healthcare facility does. Can you expand on that?
That's right, and it feels like our responsibility. Our kuleana back to the community is to do things like behavioral health services. We're the state's only Trauma One service. We have the comprehensive stroke program, which is the only one in the state, and then we're the busiest STEMI center. All these services, we have patients that come to us from around the state because when you need real care, like the most advanced care, we have made these investments in that technology and those services and those providers and make sure that everyone gets the best care no matter where you are right here in Hawaii.
That's right. Now we talked about the expansion, about the services. Now let's talk about the growth and some future projects and current ones that you're working on.
Yeah, I think there's 2 really exciting ones. The first one is an expansion over at West. So the emergency department there is almost as busy as our Manamana campus, if you can imagine that. So it's only been open for 10 years, and we never expected to see more than 120 patients a day. They're almost seeing 200 patients in their emergency department every day.
Wow.
And these patients are no less sick than anywhere else. And so we know the community is growing, so that will be the new expansion. It'll add 35 additional bays, so almost 60, and then it'll add 48 more beds. And in the end, we know that there needs to be more beds than that, but it's the first step. It's a $350 million investment back in that community, and we'll provide services that they need so desperately.
Good things coming for Queens Health Systems. And now I wanted to mention congratulations on being promoted to President and CEO. You've been in this position for the last year now. What have you learned, and what does your vision look like for the future?
Yeah, I think the thing that I've learned the most, and it means the most to me, is that Queens is so important to the state. Talked to a number of different people who said, look, just don't lose your connection back to community. Make sure you don't lose your connection back to kuleana and the people that we serve. And our mission really is founded upon Queen Emma and King Kamehameha IV, taking it all the way back home, that we want to make sure that our legacy is there for the next 165 years. It's so important to us. And so when I think about the things that we need to invest in and the things that the community, no matter where you are, rely on Queens for, we have to make sure that that stays, the most genuine thing.
Absolutely. Thank you so much for joining us, for your entire team there at Queens Health System, for all the work that you folks are doing. And I got to shout out my brother-in-law, my sister-in-law, because they're over there too, making a difference. So thank you for joining me. Of course, stay with us. We're going to have all the information on hawaiʻidaily.com. Mahalo.
Thank you.